Dr. Evans, thank you for sitting down and taking the time to explain a little bit about what you talked about today. So you had a couple different segments that you talked about, and as always, you like to say, start with the why. So why were we here today at the PTN Learning Community?
Well, the concept of the learning community is to bring people together to really understand how the world is transforming at this point. And of course, we have a lot of, healthcare transformation is the name of the game today. We have reimbursement redesign happening with the macro legislation, so we spent quite a bit of time talking about how that's going to impact the provider community beginning January 1st, 2019. And then we talked about the resources that we're bringing through the Transforming Clinical Practice Initiative to try to help prepare physicians for that day.
Yeah, and so transforming to macro and MIPS it's a really complex process. For those that are a little bit unfamiliar, I guess if you were talking to your grandmother, what would you say and how would you describe that?
The way doctors get paid is going to change dramatically in 2019. And physicians are going to get paid based on the quality that they deliver and how effectively they deliver care rather than just how many patients they see every day. It's going to be a dramatic change, it's going to influence healthcare delivery. I think it's going to actually improve the effectiveness of our care, it's going to improve patient safety, and it's going to eliminate a lot of waste within the system. Probably the most important thing is it's going to engage our patients as partners in their care going forward.
So you talked about in another one of the segments about how exactly you're going to go through this, and a lot of it is a little bit up in the air, but one of the examples you used as far as letting the systems do the change to drive to a result is JFK and the space program. So can you kind of recap that for us, and then for those that are interested, the whole story is fascinating, and it'll be in the video in the link below.
Well, the concept is that, so often we operate in these complex systems, and the way we change the system is we say, okay, we're going to make some changes, so we'll set some goals, but the system itself is kind of finite. It has certain rules and certain resources, and even though you say you want to change things, the system is only so adaptive. A more effective way to go when you have to do huge change like we have to do in healthcare today is you basically say, I'm not going to worry about the system, I'm going to identify the aim and then build systems that will achieve that aim. And I was referring to the space program. For example, today in healthcare, our current healthcare system, we're moving from a volume-based to a value-based model. That is a huge change. The space program, President Kennedy said we're going to put a man on the moon by the end of the decade. We had no idea how to put a man on the moon. We didn't have the resources, we didn't have the organizational structure, but we had a goal. And that kind of a goal, basically we created the systems around it so that eventually we developed NASA and the rockets and all the stuff to be able to achieve that goal. That's the kind of thing we're focused on today in healthcare with transformation. To do a value-based system, we're going to have to change the way the healthcare system delivers care, but we need to engage our patients and families and communities in different ways to actually build the best value-based care.
And another big portion of the day was about how you use data to drive that change. Can you kind of overview a lot of what was talked about? And again, for more very good information, the link below is going to have the full resource of contents, but overview data for us a little bit.
Well, the concept of data, I actually find when I talk to providers, hospitals and physicians about changing healthcare, it's usually our biggest barrier. We usually say, we need the data to change, but we usually say we can't get it, or it's too complicated, or it's the wrong data. So part of that presentation was about basically looking at data from different ways. What type of data is it? And it's a complex discussion, but basically acknowledging that there's different kinds of data that are used in different ways for different things. And we need to organize that appropriately and identify data streams that will actually help track our progress as we improve. So the important thing is, so much of what we've done on data in the past is getting information so we can compare ourselves to somebody else. The most important thing we need the data for today is to get the information so we can compare ourselves against ourselves as we improve process. So A, get the data, but more importantly, B, use the data to affect change to make your processes better and better.
To learn more, click on the links below. Again, thank you for watching and enjoy the rest of the conference.